Carrie, how are you?
I'm good. How are you, Haley?
Welcome back.
Thank you. I had her yesterday, so hopefully just a couple updates will be enough.
Okay. So again, this is Allison White, 25 years old, admitted yesterday for, as you know, pneumonia and sepsis.
Yes.
Neurologically, she remains on propofol at 40 and Precedex at 0.3. Her goal RAS is -3 and her actual RAS is -3. Respiratory-wise, she has the ET tube in, 18 at the teeth. She's on CMB vent settings with no changes. Cardiac-wise, her MAP has been above 60 and she's still on NEO at 40. She has a right IJ Swan, it's 54 at the hub, and a right radio A-line. GI-GU, she's got a Foley in place with good urine output. Her skin is intact, we've been turning her every couple hours. She has no nonverbal signs of pain, no grimacing with turns, she looks like she's tolerating it really well. As you met yesterday, Sarah, her sister's at the bedside.
Hi, I'm Carrie.
Hi,
I'm going to be taking care of your sister today.
Nice to meet you. Thank you so much for taking care of her.
Oh, no problem. My pleasure. Allison. Hi there. My name is Carrie. I'm going to be your nurse today, okay? We're just going to check a couple things here at the pump.
Okay, are you ready to verify the drips?
Yes, I am. We say the concentration. It's going at 40 mics per minute. Great. Okay, and the Precedex, 0.3. And then the propofol. It's going at okay, and the propofol. It's going at 40. Great. Okay, great. And I know the doctors are going to be rounding in a couple hours, so what we'd really like to do today is to stop her sedation and try to wake her up so that we can do a spontaneous awakening trial. Okay. So let's go ahead and do that now.
Okay.
So we'll turn off these medications. Hi.
Hi.
Oh, I see that you guys made an All About Me board.
Yeah, we did.
Oh, cool. So she likes to go by Allison?
Mm-hmm.
And she has 2 dogs?
Yes.
Oh, what kind?
She has a lab and a Jack Russell
Oh,
that she
nice.
loves. She adores them.
Oh,
so
that's great.
I'm sure they're missing her.
Allison. Hey, it's Carrie again. I'm your nurse. Are you having any pain right now? No? Okay, that's great. It's very important for us to assess her pain continually and, make sure that she's not having any pain. That's very important. So it looks like she's pretty awake now. So, Allison, I'm just going to have you do a couple things for me. Can you show me 2 fingers on this hand? Can you show me 2 fingers? Great job. Okay, can you squeeze this hand? Real tight. Now let go. Great. Now I'm going to be asking her a couple questions to test how clearly she's thinking.
Okay.
Allison, I need you to stay with me. I'm going to say a series of letters, okay? And every time I say the letter A, I want you to squeeze my hand real tight. Do you understand? Okay. So squeeze my hand every time I say the letter A. S. A. V. E. H. A. A. R. T. Okay, great job. We're all done. And you were to expect that all the other nurses will be, testing her every shift for this, just to test how clearly she's thinking.
Good. Thank you.
So for my patient's CAM ICU score, feature 1, she had a RAS -3 overnight and is now a RAS -1. This is demonstrating a fluctuating course, so she would be positive for feature 1. She was able to follow simple commands, but on Save a Heart, she had greater than 3 errors and displaying inattention, so for feature 2, that would also be positive. Feature 3, she fluctuated between a RAS -3 and -1, so that would also be positive. She did not have a RAS of 0. This would be an overall positive CAM ICU score. So she's overall CAM positive. We do not have to do feature 4 because she was already positive for 1, 2, and 3. All right, so it looks like you're awake enough to do a spontaneous awakening trial. We have this new algorithm that we're following. Okay, so basically with a spontaneous awakening trial, we've turned off all of her medications so that she's awake enough to follow commands. It seems like she's able to tolerate the spontaneous awakening trial. So I think the plan now would be to, possibly do a spontaneous breathing trial.
Hi, I'm Kim.
Hi,
I'm from
Sarah.
Respiratory. You're her sister? Hi.
Yes.
Hi, Allison. I'm Kim from Respiratory. We're talking about doing a spontaneous breathing trial with you today, okay? Do you know what a spontaneous breathing trial is?
Not really.
Not really. Okay. Well, I'm here to help out. We're going to assess her and see how she does on the ventilator.
Okay.
We're going to see how her volumes are in her lungs. We're going to see what she's doing on her own and how you follow commands and stuff. I'll ask you some questions, some things to do for me, okay? Okay, and what it does is we take her off the full support of the ventilator and we allow her to breathe on her own.
Okay.
So that's a good thing. That's always a good thing. So we give her minimal support, not a lot, and she does it on her own, and we're always here to assess and make sure she's doing well.
Okay.
So that's it. We give her a little bit, and then we kind of watch. Okay, Allison, we'll ask you to do some things, and we'll take some little tests, and then we'll see how she does, and you'll help, and we'll just try to get this done.
Great.
Okay?
Sounds good. Thank you.
You understand part of that?
Yes, thank you
Okay.
for explaining that.
No, not a problem. So you ready for that, Allison? Yeah, you're ready for the tube out. Okay. Great. So that's where I'll get started. So I'll just come around. I'm going to look at the ventilator and things like that and see what numbers they come up with, okay?
Okay.
So we're all on the same page?
Yes.
Great. So let's get started.
Hey, Ardell.
Hi, Carrie. How's it going?
Good, how are you?
Good. Hey, so I heard you're doing a spontaneous awakening trial here.
Yes, we are. She's actually doing great. She's been off of the propofol and Precedex for about 2 hours now. She's currently a RAS -1 and she's doing great. No signs and symptoms of pain, tolerating it well.
That's good. So were you able to follow the protocol and able to do your CAM ICU and neuro assessments?
Yes, we did the CAM ICU and the neuro assessment.
That's great. That's great. I heard you're going to keep her off the sedation to do the spontaneous breathing trial to get her to do mobility.
Yes, for now we're going to keep the sedation off, do a spontaneous breathing trial, and hope to get her out of bed even with the ET tube in.
All right. Well, you know how to get a hold of me, so if you have any questions, just hunt me down.
Sounds good.
All right.
Thanks.
Hi.
Hi.
I'm Ann from Physical Therapy. How you doing? Allison, the doctors asked me to come by and see if we could get you up and moving a little bit today. So we want to start that process, get you moving faster, okay? First, what I'd like to do is take these restraints off.
Yeah, now that she's, awake and following commands, she's not at risk for pulling that tube, so we're going to keep them off.
Are you in any pain right now? No. All right, we're going to take this blanket off here.
And Allison wears glasses because she does wear glasses.
Sure.
I think it would help.
Yeah. Oh, here they are. Important for the patients if they wear glasses to have them on when they do things.
So what we're going to do, we're going to loosen these lines here just a little bit. There we go. I'm going to have you bend your knees for me. Can you try and do that? Slide your heel towards your bottom. Yeah. Good. Okay. You're going to reach across with this arm for the edge of the bed over here. And we're going to have you roll onto your right side. What have you do is swing your feet off the edge of the bed here. Okay. And you're going to push up with this hand and this elbow. There you go. Alright, are you dizzy? No? You okay? Alright, just sitting here, what I want you to do, move your feet up and down for me. Kick your leg out straight. Good, lift your knee up. Alright, I think you're ready to try and stand here, okay?
Good job, Allison.
I got my walker here. I'm going to have you put one hand up on the walker, one hand on the bed. Alright, and we're going to try and stand up here. 1, 2, 3. Alright, take some deep breaths. Are you dizzy? No? Feeling okay? Okay, just standing here, I want you to shift your weight left and right. Good. Okay, and then just take a couple steps in place. Great. Great job. I think you're ready to go for a walk.
Allison, it's Carrie, your nurse again. So we're going to be doing what we did before. I'm going to be asking you a couple questions to test how clearly you're thinking. You seem to be awake and alert. Can you squeeze my hand for me? Okay, let go. And show me 2 fingers on that hand. Okay, great. Looks like we're able to proceed. So I'm going to be saying some letters. And every time I say the letter A, I want you to go ahead and squeeze my hand, okay? Do you understand? S. A, V, E, H, A, R, T. Great. Good job, Allison. So for my patient's CAM-ICU score this time, feature 1, acute onset or fluctuating course. She still was fluctuating between a RAS -3 and 0, so this would still be positive. However, on feature 2, she was able to perform Save-A-Heart with no errors. This would be negative. She was not inattentive for feature 2. Because she's negative for feature 2, we do not have to proceed, and she's overall CAM negative. So now what we're going to do is doctor rounds. We really want the family to be an active participant in the daily rounds. We're going to be talking about the plan for today. If you have any questions, feel free towards the end to ask any questions, and if it takes more time, we can set up a family conference. Okay?
Okay. Thank you.
Hi, Dr. Doucette.
Morning, Carrie. How's Allison doing today?
No, she's been doing really great.
What's her RAS score?
So her current RAS score is a 0.
What's our target?
The target was -3. Her sedation's been off now for a couple hours. She was on propofol at 40 and Precedex at 0.3. So she seems to be doing great with her spontaneous awakening trial.
Okay. Well, how is the CAM-ICU today?
So her CAM-ICU was actually positive a couple hours ago, but just reassessed and it's now negative.
Okay. And sedation now, what's she on?
She's completely off sedation.
Oh, good. Okay. Well, I think our plan for today is to get her mobilized. So I think it's important that we get Allison up out of bed. Even though she's still on the ventilator, we'll be careful about her tube and how it's secured. But it's important for patients as they're in the ICU to be mobile. If she's in bed too long, she's going to have more problems. So, and even though she's on the ventilator, it is possible to get her mobilized while we're trying to wean her off the ventilator.
Okay.
Hi, Carrie. Do you need any help turning her and assessing her skin? Oh, excuse me. I'm just going to get where you are.
Yeah, actually, Allison, we're going to go ahead and turn you now. Sarah, it's very important that we turn her every 2 hours. She is at risk for skin breakdown, so this is part of what we do to make sure that her skin doesn't break down since she's immobile, laying in bed. Okay. You ready to help me
yes,
turn?
Absolutely.
So let's go ahead and turn her towards me. Allison, we're going to turn you onto your right side, okay?
Right side.
Good job. And she's going to take a
quick
look at your bottom.
skin here.
Oh, goodness. It looks like you're in some pain. It's okay.
No, her skin looks good. Let me just put
Okay.
this to prop her up a little
Okay,
bit.
Allison, we're going to
Okay.
put you right back.
Okay.
You know, I'm going to go ahead and assess her nonverbal pain score right now. It looks like she was in quite a bit of pain. So for face, she was grimacing quite a bit. She was pretty restless and withdrawal of reflexes. She was pretty stiff, and her heart rate went up to 100. Her respiratory rate increased to 30. So I'm going to give her a pain score of 9, which is severe pain. I'm going to go ahead and give you some pain medicine, Allison. Allison, we're going to get you out of bed and take you for a walk, okay? We have plenty of people here. We have a couple nurses, respiratory therapist. So physical therapy has already seen you and said it's okay to get out of bed, so we're going to follow the protocol. And we can safely and effectively walk you with the respiratory therapist and the nurses. You have the non-skid footwear on. We have you hooked to the portable monitor. It's big and clunky. I wish we had a smaller one. And we have the portable vent right here ready to go.
Okay, Allison, you met me before. I'm Kim from Respiratory. I'm going to take a little bit and I want to secure your tube to make sure when we do stand you up that it's secure and you don't lose your tube. We don't want to take it out before it's ready. So I'm just going to take a piece of tape here. I'm just going to put a little extra piece of tape around the tube. Okay, so you'll feel me kind of pulling on some things. I apologize. There we go. All right, so now I want to get the transport ventilator and we're going to get this, it's all turned on, ready to go. So I'm going to ask you just to go ahead and take that off and we're going to make this switch. I take that, go ahead and turn that toggle there. Now you're on the transport monitor, or the ventilator here. And I'm just going to secure this to your shirt and that's going to help you to not have this tube move too much, okay? How's that feel? Okay, so if anybody else is ready, it's up to you, and I'm right here for you, okay?
Great. Let's go ahead and check a blood pressure first. And while that's going, Megan, do you mind watching the lines for me? She has a swan and an A line in. And Peggy, would you mind grabbing the monitor?
Grab the monitor.
Okay.
Great.
Can I help in any way? I think we're good. If you just want to stand by and maybe be here for support, that'd be great. Thanks. It looks like her blood pressure is great, so I think it's safe to go. It's safe to go ahead and get her up. So let's take your blanket off. Okay. So Allison, what the physical therapist had taught you before is we want you to go ahead and slowly move your legs to the side. Bring this arm over and watch this, okay? We want you to grab the side of the rail right there. Okay, great job. Good job. And while you're sitting here, do you feel dizzy? We're going to go ahead and check your blood pressure again. A lot of times when patients are in bed for a long time and they get up for the first time, they tend to be kind of dizzy and their blood pressure drops, so we just want to make sure it's safe to proceed. Okay, blood pressure looks great. No changes. You ready to stand up? Okay, everyone ready? Okay, on the count of 3. Ready? 1, 2, 3. Stand up nice and tall. Look straight ahead. Do you feel dizzy? Good, you're nice and strong. Let's go ahead and try to take a couple steps. Let's check a blood pressure again. Just check the difference and make sure there hasn't been a drop. Blood pressure looks great. Let's take a couple steps. You're doing great.
You look great, Allison.
Yeah.
So good to see you up.
Right.
Great job.
What you've just seen is a video that briefly demonstrates the best evidence-based practice for spontaneous awakening trial, STEER protocol, CAM assessment, early mobilization, patient and family-centered care. This is a big transition that the entire critical care team is taking on together. Thank you for watching.